So this is the proportion of balanced diet. So what is micronutrients and macronutrients? Anybody? So nutrition is an essential requirement of human being to stay healthy. Okay. It helps identify malnutrition, obesity, and diet-related disorder. And it's conducted during our family visit. During our fourth or fifth visit, we have to assess the nutritional status of this family. So nutrition is an essential requirement of human being to stay healthy. Food consumption determines the nutrition and health status of the population. And food consumption itself is determined by the influenced by the production, individual purchase power, and many more things. Since we consume food, not nutrients, so it is essential to understand the nutrition in the language of food. Objective is to assess nutritional status of family members, including children, to identify at-risk individuals, to provide dietary counseling and intervention, and monitor improvement over time. What is anthropometry? Anybody? So in the picture, what they are doing? They are taking anthropometric measurement like head circumference, height, weight. These are the anthropometric measurement. And the second is clinical assessment, dietary assessment, biochemical assessment like vitamin test, and the fifth is socioeconomic and environmental factors. Mainly refers to the earning number of the family or the earning members. So this is the framework for nutritional assessment. The first is intake of food and nutrients, then change in body composition, then disease occurs. Then after the disease, clinical assessment and biochemical marker. And due to changes in body composition, there should be anthropometric changes. And due to intake of food and nutrients, dietary intake assessment is required. So we will learn by 24-hour recall method. So what is 24-hour recall method? Anyone? It is anthropometric assessment. It's measurement of height, weight, BMI. And what is BMI? It's weight divided by height square, meter square. And anthropometric assessment helps to detect undernutrition or overweight children. For signs of nutrient deficiency like pale conjunctiva in iron deficiency, Bitot spot in vitamin A deficiency, and edema in protein deficiency. Then the observation of hair, skin, eyes, and tongue condition. By seeing hair, skin, eye, and tongue, we can assess the health status of the individuals. Method, we will assess the health status, nutritional status of the family during our family nutrition program visit. It's probably on 4th or 5th visit. Then the other methods are food frequency questionnaires, assessment of portions, sizes and meal patterns, comparison with recommended dietary allowances.